Placing an intravenous catheter is a learned and practiced skill, and a highly valuable skill to have. Each animal is going to react differently to IV catheter placement. Some do not react or mind, some are so ill that they aren't aware, and some animals are healthy but react to either the restraint or the catheter. Knowing the patient and being able to assess temperament and the situation is helpful in each case. The actual placement of the catheter, securing the catheter so that the patient does not remove or dislodge it, and the restraint needed to hold the animal still for catheter placement are all important aspects of this procedure, regardless of the location where the catheter is being placed. The catheter you choose will depend on its intended use, length of time needed, site of placement, and size of the vein. You want to minimize patient trauma by selecting a catheter that will sit comfortably within its vein. You will need an IV catheter, syringe with saline flush, clippers with a number 40 blade, an injection cap, gauze soaked in chlorhexidine scrub, gauze soaked in alcohol or saline, and several lengths of medical tape. With the holder positioning the animal similarly for cephalic venipuncture, palpate the cephalic vein. You will want to choose a site that is as distal on the limb as possible in case more than one attempt is needed. Shave a rectangle of fur from the intended insertion site at least 1 to 2 inches in each direction, more if the animal has long fur. Remove loose fur from the patient. Palpate the vein to visualize your catheter placement. Use the target or bullseye method to scrub the site with chlorhexidine gauze, then rinse with alcohol or saline gauze. Repeat this cycle a total of 3 times. Remove the outer wrap or encasement from the catheter. Flush the catheter with sterile saline prior to placement to ensure effectiveness. Be sure to keep the actual catheter sterile and visually inspect to check to make sure there are no burrs. Put on non-sterile exam gloves. Hold the distal end of the limb in your non-dominant hand, using your thumb as a guide next to the vein, but be sure not to touch the scrubbed area, if you wish. Holding the catheter bevel up with your thumb and forefinger at the point where the catheter hub meets the base of the catheter, penetrate the skin and vein at about a 10 to 20 degree angle depending on the depth of the vein. Check the stylet for blood flow, flash. If present, advance the catheter and style it 1 to 2 millimeters. If blood continues to flow, slide the catheter off the stylet and into the vein completely. If blood flow is not present at initial puncture, redirect the catheter. Remove the stylet and attach the injection cap. Place 1 piece of tape over the catheter insertion site and wrap around the limb twice. Place a second piece of tape with a small notch at one end under the catheter and injection cap so the cap rests in the notch. This tape should also encircle the limb twice. More tape may be needed for security or if using a T-port. Flush the catheter with saline to ensure good flow. If you flush the catheter and notice swelling, the catheter is not in place. You can also flush 1 milliliter of saline into the catheter and immediately attempt to aspirate with the same syringe. If you get good blood flow back, the catheter is in place. Protect the catheter if necessary with vet wrap, a catheter guard, or an e-collar.